Billionaire entrepreneur Mark Cuban testifies before Congress, tackling the broken system behind sky-high drug prices. Watch as he faces off with senators. Here are the top moments.
My Shark Tank companies hate selling on Amazon, but most don't have a choice. About 162 million Americans shop there, and if you want to reach them, you have to play by Amazon's rules. Amazon knows this and takes full advantage, adding and raising fees, and even launching competitive knockoffs. They get away with it because they control the marketplace and because 162 million people shop there, which makes Amazon incredibly sticky. So what does that have to do with healthcare? Insurance companies work the same way. Over 300 million Americans have some kind of coverage: commercial, ACA, Medicare, or Medicaid. Every one of those plans hires a pharmacy benefit manager or PBM to run their drug benefits. The biggest PBMs, all owned by the largest insurance companies, control pharmacy benefits for about 270 million Americans. That's a lot of power. And that's also 70% more people than Amazon reaches. Like Amazon, PBMs control the store shelves, but their shelves are called formularies. The list of drugs your insurance will cover, and if a drug isn't on the formulary, it's invisible to doctors and patients. But here's the kicker. Unlike Amazon, which wants lower prices, PBMs actually prefer higher prices. They say they negotiate lower drug costs, but they don't. They auction off access to their formularies to the highest bidders. Drug companies pay the rebates and fees PBMs demand so their drugs can be covered and prescribed. If they don't pay, they lose access to millions of patients and plenty of doctors, costing them billions. These rebates and fees are based on a percentage of a drug's list price called WAC, the wholesale acquisition cost. The higher the list price, the more money PBMs make. Because PBMs are so powerful, that inflated list price becomes the reference point for the entire drug supply chain. Take a hypothetical $600 brand name drug. The PBM strongly suggests the manufacturer set the price at $600 with a 50% rebate and another 10% in fees, leaving the manufacturer with $240 net. Meanwhile, wholesalers buy the drug at that same $600 list price. How many industries do you know where the wholesalers pay the full list price? The three major wholesalers all use the same list price and get paid almost identical fees. There's zero competition, and their fees are also, because they're tied to list price, they make more money when prices rise. Pharmacies buy from wholesalers at about a 5% discount. You'd think PBMs would reimburse them more than their costs so they can make a profit. They don't. When a pharmacy fills a brand prescription for an insured patient, it's often reimbursed less than what it paid for it. And if it doesn't fill enough of those money-losing prescriptions, PBMs or wholesalers can penalize them. It's no wonder independent pharmacies are disappearing. Now, what does the patient pay? If they're uninsured, they pay that $600 list price. If they're insured but haven't met their deductible, they still pay the full $600. That's crazy. We were told that PBMs negotiate lower prices for patients, but they're so bad at their jobs, they can't even get patients a deal that's better than the retail price. But the rebates and fees that they collect on that $600 flow straight from the patient's pocket to theirs. Patients are getting ripped off because PBMs and wholesalers insist on using inflated list prices instead of transparent net prices. Because the whole system is built around list prices, everyone, PBMs, wholesalers, and insurers have an incentive to keep prices rising, and they almost always do. It's costing patients tens of billions of dollars and forcing many to go without the medications they need. But here's the saddest part. Self-insured employers, states, the federal government, they all keep on signing contracts that lock in this broken system. We blame PBMs, but the real problem is the CEOs, administrators, and state officials who keep renewing these contracts. Every one of them complains about rising healthcare costs while signing deals that make prices go up. Big brand pharma is part of the problem too. They hate PBMs, but still play along. If manufacturers, wholesalers, and payers move to net pricing, meaning the price after all rebate and fees, patients' out-of-pocket costs could drop by half overnight, saving patients billions every year. There's a reason the U.S. has the highest drug prices in the world. We're the only country that uses PBMs. And there's a reason we have some of the lowest priced generics. PBMs can't control generic pricing from companies like Cost Plus Drugs. So what do? One, count all cash payments towards deductibles. Two, base patient out-of-pocket costs on net price, not list price. Three, separate formularies from PBMs to end their power. And four, and specialty tiers. It's just an excuse to charge more. Fix that, and we finally put patients, not PBMs, back at the center of American healthcare.
President Trump has announced Trump RX, a new website to connect patients directly with the best prices. How might Trump and RX and direct patient programs improve affordability for patients? Your basic why you're doing this.
Yeah, I mean, we'll work with Trump RX. I mean, it's incredible. It's stupendous. It's like the most incredible program ever. And so we're excited to offer them our API so that they'll be able to download our daily prices. So when they go down, everybody benefits. Plus, I like what they're doing with the MFNs because, as I mentioned in my comments, our brand drugs are more expensive because PBMs are involved. And with Trump RX and the MFN program, that allows manufacturers to work around the PBMs and work directly to patients. So I think it'll save seniors, it'll save everybody a lot of money.
You think this is the future?
I don't think it solves the ultimate problem of how the system is designed, but I think it's something that we obviously agree on because that's what Cost Plus Drugs is. We publish our entire price list every day.
Your company posts drug prices with full cost breakdowns. How does this transparency help save patients money?
I mean, you know, with costplusdrugs.com, any patient can just go look at their price for their medication. And so there's no uncertainty. But more importantly, by seeing our markup of only 15% and seeing our costs, that builds trust. I always tell everybody in our company that what we really sell in this industry is trust. And so I think that's what's really allowed us to grow so quickly.
So if you sold Ozempic and somebody else went through PBMs, how much cost would they save?
Well, if you look at what's happening now where the PBMs work with sponsors, they're typically being charged $1,300. And if you look at the direct-to-consumer programs that are being put out there by Novo and Lilly, it's $499 or less and probably falling. So there's already a significant difference. And the crazy part is that difference of $800 typically goes right into the pocket of the PBM, who then decides how much they're going to give to the employer. So it's a huge amount as of right now.
What does this vicious cycle of unaffordable health care costs lead to, and how does it stress the healthcare system?
Well, no matter what your premiums are, and you pay them, if you can't afford your deductible, you don't really have insurance. And what ends up happening is either you go to the emergency room, you do nothing at all, or you're at the mercy of the provider, hoping they can provide some sort of financing for you. Either way, it creates very difficult situations for seniors, for entrepreneurs, for anybody in that situation. And as I alluded to in my comments, we don't do anything to help people who are unable to afford their deductibles. And in fact, we make it more difficult. Dr. Smith alluded to the fact that, the cost of a surgery could be extremely high, and if you can't afford your deductible, you can't get it. In the case of pharmacy benefits, if you have a drug like Eliquis where the list price is $600 and you have a $4,500 deductible under an ACA Silver plan, you're going 7 months having to pay full list price. And if you can't afford to do that, you're out of luck.
Mr. Cuban, most Americans probably know you as an investor in startups and innovative small businesses. I'm a fan of Shark Tank.
Thanks.
In that role and as an entrepreneur yourself, is it fair to say that you know a little bit about how small business owners and entrepreneurs think about their money and startup expenses?
I would say so, yes.
And would you say that among those considerations and expenses, that includes their healthcare expenses?
Yes.
And how their healthcare costs factor into their plans for growth and sustainability?
Yes, sir.
So let me show you something. This is the cost of the premium for a senior, 2025. This person is 62 years old, small business owner in Georgia, taking home just $65,000 in 2025. The other side shows the cheapest option for that same Georgian. So $228, 17 cents a month. Now, with the expiration of these tax premiums, $1,142.71. That's quite a jump. How would this monthly jump affect that Georgian's ability to grow her small business or even just make ends meet?
It makes her make a lot of hard choices, either to try to find the money to pay for the premiums or to go without insurance. And I think the greatest challenge has been in all of this is that small business owners, Americans that are on the ACA, haven't had enough time to plan for it. It's one thing to know that your premiums are going up. It's another thing not to know how much and how soon, right? And so now we're just, in Texas, people are just now starting to see open enrollment, and more we'll see in a couple weeks. And as a small business looking to the ACA for their employees, it's going to be terrifying for them.
And if they forego insurance, is it fair to say that would drive up premiums for everybody?
Yeah, of course, because healthy people are going to be most likely not to take insurance.
Right. And this gut punch for small businesses impacts the overall economy because small businesses are such a big part of our economy.
Well, of course, if there are 33 million companies in this country, 30 million of them are solopreneurs, one-person entrepreneurs, companies. And if you're taking $800, give or take, a month out of their pocketbooks, they can't invest it in inventory, et cetera, et cetera. So it makes it much more difficult to run your company.
Since 2009, the TRICARE pharmacy benefit has been administered by Express Scripts, the nation's largest pharmacy benefit manager, or PBM. Express Scripts decides which pharmacies are in-network or out. So when one of those 9 million military families needs to pick up a prescription, Express Scripts decides where they can go to have it filled, and then they pay the pharmacy. Now, Express Scripts is owned by the multi-billion-dollar health insurance company Cigna, and Cigna also owns a mail-order pharmacy called Accredo that participates in TRICARE. In other words, Cigna owns the company that pays the pharmacies, and it also owns the pharmacy chain that is getting paid. The result? Well, Express Scripts can under-reimburse the other pharmacies and give inflated payments to its corporate cousin, Accredo. Express Scripts has been caught doing exactly that kind of self-dealing in other government programs, but right now the Department of Defense refuses to check how much it is costing taxpayers in TRICARE. Mr. Cuban, you understand this business, so let me ask you, would requiring Express Scripts to disclose the difference between what it pays its affiliated pharmacies and the unaffiliated pharmacies help save taxpayers' money or cost taxpayers' money?
It would save a lot of money, and it would keep smaller independent pharmacies in business.
Okay, that makes sense to me. It seems pretty common sense here. More transparency would save taxpayer money. But the Congressional Budget Office disagrees with you and me on this. According to the CBO, price transparency would cost taxpayers money because other pharmacies would allegedly band together to demand higher reimbursements. That's their argument here. Mr. Cuban, you talk with pharmacists a lot. Do you think that independent pharmacists don't know that Accredo right now is getting a sweetheart deal and that the independents are just waiting for information to be told so that they could demand more money?
I can't speak for all the independents, but I can speak for costplusdrugs.com. And so I went to TRICARE, and I have done this in the past many times, and looked up the price of some common low-cost drugs. So just recently I looked up Tadalafil, right? And our price is lower, whether it's 30 or 90 pills, than the TRICARE price is for anybody who is in-network but off-base. And if they're out-of-network, we're dramatically lower. So we don't need to band together to know that we can be cheaper. All we have to do is look at some of their prices, and it's obvious that we're cheaper.
Okay, so this information is actually already out there.
Yeah, I mean, it's just by looking at, and I'm just talking about the copays.
Yeah.
We're not even talking about what the taxpayers still have to pay to Express Scripts, Accredo, right? Which is more, they're not doing this for nothing. And so, I mean, taxpayers are getting ripped off, period, end of story.
Okay, and this is where I want to see more transparency. You think
Correct.
that's a good thing?
That's a great thing.
Okay, that's a great thing. Good, I'll settle for that answer.
But in a state like ours, Mr. Cuban, many people rely on independent pharmacies. What kind of pressures are the PBMs putting on these pharmacies?
It's horrific. So I mentioned in my testimony that, first of all, the wholesalers buy drugs at the list price. And then they sell to the pharmacies at just under the list price, which means those independent pharmacies, small businesses, are out a lot of money. So for instance, on an Eliquis $600 point price, they're out $570. And they need to collect that money back as soon as possible. What PBMs do is not only wait to get the value of the float, but they also under-reimburse them. So instead of paying them at least the $570 so they can break even, they pay them less, knowing that there's only so much they can take where they'll either A, go out of business, or B, send the prescription to one of their captive pharmacies. And that in turn means they're not supporting their patients. And let me tell you something that a lot of people don't appreciate. That last 5 feet between the patient and the pharmacist is some of the most important time any patient will ever spend, because if they're getting medications that conflict with each other, then some really bad things can happen. So we underappreciate pharmacies, and the big PBMs are literally, purposely, as far as I can tell, putting them out of business.
Mr. Cuban, you want to talk a little bit just about the opaqueness of PBMs, the traditional PBMs, and how they truly are hiding the cost from my mom and dad when they go to their local pharmacist.
Cost Plus has been in business 3.5 years, and we're still the only pharmacy that publishes their entire price list. As Mr. Moles mentioned, he used us as a reference price. When the FTC investigated the PBMs, they used Cost Plus Drugs price list as a reference price. And so they're doing all they can to prevent transparency. They also do the same thing with contracts. Anytime you have a contract with an employer in particular, or state or federal government, they always put in there may be other fees that we charge you, right? And then they'll play games like with rebate GPOs. What a rebate GPO is, you would think a PBM is big enough to just negotiate with the brand manufacturers and get the best rebates they can. But that's not what they do. They create these intermediary subsidiaries called rebate GPOs that in turn go and negotiate with the brand manufacturers, take, in any given example, 60% in rebates, give back 40% to the actual PBM, who in turn goes to the plan sponsor and says, here's the whole 40%, not disclosing that they kept 20% through their rebate GPO. So those are the types of things, and there's a long list more. But I will say, the one thing for every employer or anybody listening is if you're paying any fees as a percentage of a price of a drug, you're getting ripped off.
That's why we call it our delinking bill takes care of that as well.
For more congressional news, stay tuned to Congress Clips, and thanks for watching.